You know, after spending decades as a heart surgeon, seeing countless seniors come through my doors, one thing has become crystal clear. So many are worried about chest pain, feeling out of breath, or just sudden tiredness. And surprisingly, the culprit isn't always just what they eat or how stressed they are. More often than you'd think, it's a medication they've been on for years, sometimes even given to help something else entirely. It's a tough truth many over 60 don't realize. Some everyday pills, taken by millions, can silently mess with your heart muscle, bump up your blood pressure, or cause weird heart rhythms. These aren't pills that show their nasty side effects overnight, but give them time, and they can really wear down your heart and, yes, shorten your life. In this video, I'm going to pull back the curtain on 7 pills that might be quietly hurting your heart, and you wouldn't even know it. This isn't about scaring you. It's about waking you up and giving you power. If you, or someone you care about, is over 60 and taking pills for pain, sleep, sugar levels, or even your mood, you absolutely need to stick around for this whole video. The very first pill we'll talk about is the most common, and honestly, the most concerning. Now, I'm not telling you to suddenly stop anything without talking to your doctor first, but you deserve to know what's really going on. Let's start with pill number 7. Pill number 7, those go-to-pain relievers you grab off the shelf. These are your non-steroidal anti-inflammatory drugs, or NSAIDs. Think ibuprofen, naproxen. You reach for them when your joints ache, your back is killing you, stuff that's super common as we get older. Millions of seniors use them daily without realizing the potential danger lurking for their heart. NSAIDs can actually make your blood pressure creep up and cause your body to hold onto extra fluid like a sponge. That puts a real strain on your heart, forcing it to work harder. If your heart is already a bit weaker or just aging, that extra pressure can be enough to trigger heart failure or make your heartbeat go all over the place, like a drum solo gone wrong. Over time, these can even start to damage your blood vessels and make your kidneys work less effectively, adding even more stress to your whole system. If you're already dealing with high blood pressure or taking heart medications, these pills can quietly mess with how well your treatment works, almost like they're fighting your other meds. You might not feel it immediately, but your heart is constantly under more pressure. That's exactly why I always tell my older patients to be super careful with those over-the-counter pain pills. There are definitely safer ways to handle pain that won't put your heart at risk. Please talk to your doctor before you keep taking NSAIDs for more than just a few days. Pain relief should never, ever come at the expense of your heart health. If you're finding this information eye-opening, hit that comments section below and type the number 7. Let me know you're watching and paying attention. Moving on to pill number 6, which can be even more dangerous over time. Pill 6, certain medications for managing diabetes, specifically a group called thiazolidinedians. If you're managing type 2 diabetes, you might be prescribed something like pioglitazone from this group. They're meant to lower your blood sugar, which is good and necessary, but they can quietly do a number on your heart. These pills can cause your body to hold onto fluid, making your ankles and legs swell up, and they can even lead to congestive heart failure, especially for seniors over 60. Imagine your heart trying to pump through extra fluid. It's a lot of extra work. While the goal is to get your blood sugar under control, the hidden risk to your heart is really serious. Many seniors with diabetes are already at a higher risk for heart problems. When you add a drug that makes your heart work harder by making your body keep extra fluid, it's a dangerous mix, like adding extra weight to your heart's workload. What's even worse is these pills can hide early signs of heart failure, like just feeling tired or short of breath, making you think it's just old age. Some doctors still prescribe them because they work well for blood sugar. But if you've had heart issues before, or even notice mild swelling, this medication can silently speed up damage. Always ask your doctor if there's a safer option available. Managing your blood sugar is important, absolutely, but not if it means making your heart weaker in the process. Tell me in the comments, have you or someone you know experienced swelling while on diabetes medication? Share your experience with number 6. Let's talk about pill number 5, something millions of seniors are still taking every single night just to get some sleep. Pill 5, sleeping pills. These are the sedative hypnotics. So many seniors struggle with getting enough sleep and rely on medications like Zolpidem or older ones like diazepam. They promise a good night's rest, but they often come with some serious baggage for your heart. Sedatives basically slow down your whole nervous system, including your heart rate and blood pressure. While that might sound calming, it actually makes it harder for your body to handle stress or get enough oxygen while you're sleeping. Think of it like dimming the lights on your body's alert system. Over time, these drugs can cause sleep apnea or make existing apnea worse. That's when you stop breathing for short moments during the night. This puts extreme pressure on your heart and can lead to dangerous heart rhythm problems. Plus, these medications can interfere with important heart medicines you might be taking, like beta blockers, making them less effective, like they're canceling each other out. The risk of falling, feeling confused, and having breathing issues all go up as you get older, especially if you're on several medications. Poor sleep is a problem that needs fixing, yes, but relying on sedatives long-term can slowly harm both your brain and your heart. There are natural and safer ways to improve your sleep without this kind of damage. Talk to your healthcare provider before you keep taking any sleeping pill regularly. Your sleep is precious, but so is your heart. What's your biggest challenge with sleep? Let me know in the comments with the number 5. Maybe someone else has found a solution that could help you. Now we're moving to pill number 4, a common type of medication for mood that might be slowly hurting your heart without you even realizing it. Pill 4, tricyclic antidepressants. These are older types of medications given for depression, anxiety, or ongoing pain. Drugs like amitriptyline or nortriptyline were used a lot back in the day, but they come with heart risks, especially for folks over 60. These medications can cause issues with your heart like irregular beats, changes in blood pressure, and even a serious condition called heart block. Over time, they can mess with the electrical signals that control how your heart beats, like static on a radio signal. This makes them particularly risky for seniors who already have irregular heartbeats or a slow pulse. These drugs also increase the chance of feeling dizzy and falling, which can lead to injuries and more problems. Even a small dose, taken for a long time without checking in with your doctor, can be harmful. There are newer antidepressants out there that are much safer for both the heart and brain in older adults. Sadly, some doctors still prescribe these older ones out of habit or maybe because they cost less. But your health is worth more than saving a few bucks. If you're taking a tricyclic antidepressant and feel worn out, dizzy, or like your heart is fluttering, please do not ignore it. That's your body sending you a signal. Always ask your doctor if there's a safer alternative for you. Have you ever felt dizzy or had heart flutters on medication? Share your experience with number 4. Your story might help someone else realize they aren't alone. Up next is pill number 3, something millions of seniors take daily for a very common issue, but with some hidden dangers. Before we get to pill number 3, there's something important I want to share. If you're over 60 and taking medications, or just want to take extra good care of your heart, think about downloading the Senior Health Tracker app. It's designed specifically for seniors to help you keep track of your medications, log any symptoms you notice, and catch early warning signs before things get serious. Most apps aren't really made with people your age in mind, but this one is built with your needs first. Because lots of people want it, we only have limited spots open this week, so don't wait around. Stay safe, stay informed, and stay in charge of your heart health. You can find the download link right there in the comments section and also in the description below. Get the Senior Health Tracker today before your heart sends you a warning you can't afford to miss. All right, pill number 3, decongestants. We're talking about ingredients like pseudoephedrine and phenylephrine. You find these in lots of cold and allergy medicines. Seniors often reach for them to clear up a stuffy nose or sinus pressure, especially when the seasons change and allergies hit. But these pills can be quite dangerous for your heart. How they work is by making your blood vessels narrower to reduce swelling in your nose. But they also narrow blood vessels all over your body, including the ones that feed your heart. This is like squeezing a hose. It pushes your blood pressure up and forces your heart to work a lot harder to pump blood. For seniors, this extra workload can be dangerous, especially if you already have high blood pressure or heart disease. These pills can also make your heart beat irregularly or cause palpitations, that feeling like your heart is skipping a beat or fluttering. You might feel jittery, anxious, or even lightheaded after taking them. That's your heart trying to tell you something isn't right. A lot of people just assume these medications are safe because you can buy them without a prescription. But age changes how your body reacts, and what felt fine in your 40s could now be a big risk for your heart. Always read the labels very carefully and talk to your doctor before using any decongestant. There are often safer alternatives for congestion relief. What are your go-to remedies for colds? Share with number 3 in the comments. Let's share some ideas. Let's move on to pill number 2. This is one that seniors often take for long-term acid reflux without realizing its quiet effects on their heart. Pill 2, proton pump inhibitors, or PPIs. These are medications commonly known as PPIs, like omeprazole or pantoprazole, used to treat acid reflux and heartburn. Millions of seniors rely on these pills daily, believing they are completely safe, a simple fix for an annoying problem. But recent studies have shown that long-term use can increase your risk of heart problems. PPIs reduce stomach acid, which is helpful for reflux, but that same acid is also essential for absorbing key nutrients your body needs, like magnesium. Low magnesium levels can lead to irregular heartbeats, feeling tired all the time, and even muscle weakness. Over time, PPIs can also disrupt the good bacteria in your gut and contribute to inflammation throughout your body, which is directly linked to heart disease. If you are taking PPIs for more than a few weeks, and especially if you are over 60, it's time to reassess. These medications should only be used for short-term relief unless absolutely necessary. If you're experiencing persistent heartburn, work with your doctor to find the root cause rather than just masking it with a pill. Your long-term heart health must always come first. Are you taking a PPI for acid reflux? Share your experience with number 2. Now it's time to reveal pill number 1, the most dangerous and commonly used pill that is quietly weakening senior hearts across the world. Pill 1, calcium channel blockers. Calcium channel blockers are medications often prescribed for high blood pressure, chest pain, or irregular heart rhythms. But certain types, especially older ones like verapamil and diltiazem, can be dangerous for seniors. While these pills are effective at relaxing blood vessels, they can also slow down the heart too much. For seniors whose heart function may already be reduced, this can lead to dangerously low heart rates, feeling dizzy, and even fainting. It's like the heart's pace setter is turned down too low. Over time, they may cause swelling in the legs, shortness of breath, and changes in your heart rhythm. Some calcium channel blockers can also interfere with other medications seniors often take, increasing the risk of complications, like adding fuel to a fire. The biggest issue is that many seniors are prescribed these without regular monitoring, and side effects may be blamed on age rather than the drug itself. If you are experiencing fatigue, swelling, or a slow pulse while on these medications, it could be a warning sign you shouldn't ignore. Never stop heart medication without your doctor's supervision, but always ask if there's a newer, safer option for your condition. This pill is powerful, but it needs close oversight to be safe. Have you been prescribed a calcium channel blocker? Let me know in the comments with number 1. Now, let's wrap up everything we've learned today with a final thought. If you're over 60 and taking any of the pills we discussed today, I am absolutely not telling you to stop them on your own. That could be dangerous, but I am urging you strongly to talk to your doctor about what we've discussed. These pills were designed to help, and they can be life-saving, but when taken long-term or without proper monitoring, they can slowly damage your heart. As a heart surgeon, I've seen too many seniors hospitalized not because of a new illness, but because of the side effects of their medications, side effects that could have been avoided. The goal here is not to create fear, but to empower you with awareness and encourage prevention. With the right information and support, you can protect your heart, live longer, and feel better every day. And don't forget, tools like the Senior Health Tracker app can be a great help to track your symptoms, remind you about medications, and keep your heart safer every day. Now is the time to take control of your health journey. Stay informed, stay alert, and never be afraid to ask questions about the pills you're taking. Your heart is too important to ignore its whispers or its warning signs. If you found this video helpful and valuable, please do me a favor and share it with your loved ones. You could literally save a life. And subscribe for more life-saving advice tailored for seniors like you. Take care and stay heartstrong.